Hi, I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and someone who's been living with my own chronic pain for over 30 years. I've also been working with people professionally for over 29 years now. Today I want to talk about what happened with one of my patients this morning. When he came in, I noticed that he was extremely depressed. His facial expressions, his body language, his tone of voice, very flat. And as I started working with him, I started noticing he had caught the chronic pain trance. The chronic pain trance is a set of automatic and unconscious reactions people develop to living with debilitating chronic pain. They become hopeless and helpless. Their thinking becomes very negative. Their emotions become hopeless, fear, anxiety, and all they want to do is isolate and pull back. Some people even get to the point of looking for the long-term solution to a short-term problem, suicide. I can remember the days back in my early pain management recovery where I was in my own chronic pain trance. And believe me, that was not a pretty place to be. I thought my life was over, why go on? And as I was working with my patient this morning, I saw that he was in that place too. It took a lot of work to work with him to help assess and identify some of his negative thoughts and belief systems that was driving and fueling this chronic pain trance. He's only been on antidepressants for a few weeks now, and it's going to take longer than that. One of the things I need to get him to do is to start doing some of the cognitive behavioral, changing his thinking, how he manages his feelings, and what he does. And also to increase his socialization and decrease his isolation tendencies. As I was working with him today, it just brought back the importance of giving people some hope. By the end of the session, he was feeling a bit more hopeful. And that is what we really want to do. I really want him to get out of that suffering. And I told him flat out that freedom from suffering was his right, but it was also his responsibility. And he needs to be an active participant in his own healing process. My job is to be the best coach and guide that I can be to help him through this landmine called the chronic pain trance. It is possible to resolve. To learn more, you can go to the websites addictionfree.com and freedomfromsuffering.net. And believe me, hope is possible. I write a lot about this chronic pain trance in my latest book, Freedom from Suffering, A Journey of Hope. And it's really important that we help people get out of this chronic pain trance, because for some people, they'll choose the long-term choice and they won't be here anymore to help. Thank you very much.